This is a short video on how to use a pulse oximeter, also known as an oxygen saturation monitor. It's a very handy bit of kit that can help you to monitor the percentage of oxygen in your bloodstream and your pulse rate. Before you start, you want to be sitting comfortably, you want to be warm. So this is placed, the pulse oximeter is placed on a finger, doesn't matter which finger, but it does matter that your hands are clean and dry, and that ideally you don't have nail varnish on, certainly not gel or shellac, which can affect the reading and indeed mean that you don't get any reading. If you have got shellac or gel on, you could try turning the monitor round. Often it won't work. So place the monitor on your finger. Often it then needs to be turned on. You will then see a bar coming up. That is the strength of the signal. You often need to wait about 30 seconds for the reading to come up. In terms of the reading, you are looking for your oxygen saturation to be above 96%, your pulse to be above 50 but below 100. If you find that your readings are outside of that range, so an oxygen saturation below 96% or a pulse below 50 or above 100, just sit calmly for 5 minutes, rest, relax, take a few deep breaths, have a cough and repeat the reading. If you are still getting readings that show you have an oxygen saturation of below 96, pulse below 50 or above 100, what we would suggest is that you either refer to the Amberley Parish algorithm, or if in doubt, seek medical advice via 111 or your GP. If you have got coronavirus symptoms, your oxygen saturation and pulse are normal, but you are feeling more short of breath, particularly on exertion, if you have any chest tightness, if you're feeling unwell in yourself, it may be helpful to repeat the reading after you've done some exertion. So walking up and down the stairs or taking 40 steps, then putting the monitor back on your finger to see if there is a deterioration particularly in your oxygen saturation. These readings are particularly helpful for any healthcare professional that is trying to assess you, particularly as most assessments will initially be done virtually, and they will enable the healthcare professional to advise you on whether it is safe to manage you at home or whether you may need to seek medical hospital treatment. It can also be very helpful for them to be able to measure your respiratory rate. So that is the number of breaths that you take in 1 minute. A breath is a full breath in and out. It needs to be just as you are normally breathing at rest, not doing anything particular. You need either a watch with a second hand or a timer, so smartphones can be particularly helpful for this, but equally an egg timer works, and you count the number of respirations that you take in a minute, and ideally we would want the number of respirations that you're taking in a minute to be below 20. So I hope that this is a helpful way to help you to manage and understand how to take an overview of your symptoms at home.